talk with you about facelifting. I do two basic kinds of facelifts. A mini facelift is a relatively small procedure, minimal incision that can be done under local anesthesia in the office, and the full facelift, which is a larger procedure that is something we typically do in a surgery center or hospital. When a patient comes in for a consultation, we talk about all the different options, we examine the patient, and we determine which procedure would make the most sense. Some patients would benefit from a mini facelift, some patients from a full facelift, and then there's a group of patients who could do either procedure, and we decide which procedure makes the most sense depending on the patient's needs and desires. Some patients are afraid of having an operated, pulled look after facelift surgery. Our philosophy is to give as natural of an appearance as possible, and we take great pains to achieve this. We work on the muscle layer below the skin with a mini facelift and with our full facelift, and this is what helps achieve that natural look. The post-op recovery period is different with a mini facelift versus a full facelift. After a mini facelift, patients often return to work very soon after surgery, even after just a few days. They may still have sutures in place, but they can wear their hair down and have minimal signs of having had surgery. Whereas with a full facelift, we typically tell patients that a 2-week period prior to returning to work is advisable. The post-op results can be seen immediately after surgery. The patient typically would see the result the next day when the dressing is changed, but immediately patients would see that their jowls are repositioned, their neck is tightened, and that they have a much more youthful appearance.
My name is Kay Moore, and I decided to get a mini facelift. I wanted to look refreshed, and there's not many doctors I could trust in doing my face. Since I worked with Dr. Pontell and know what he does, I felt very relaxed and comfortable with him and decided just to get the mini facelift done. After the surgery was over, I returned to my desk. Even though I had bandages on my head, I decided, I felt fine, I had no pain. And 10 days later, he took the sutures out, and I was just very, very happy with results. And I recommend having mini facelift to anyone because it's an easy surgery to have. It doesn't have to be done under general anesthesia. And as my results showed, that it certainly has helped me look much younger, and I'm just very pleased. I recommend Dr. Pontell to anyone.